Well, for many people, it's hard to recognize when a loved one is struggling.
That's right. So here to help and talk more about common signs to look for, we've got Chris Griffith with Christian Appalachian Project. Thanks so much for coming in.
Thank you so much for having me.
Yeah.
And Chris, this is a topic, May is Mental Health Awareness Month. We can't talk about enough. So talk a little bit about common signs as someone may be concerned about a family member or a loved one or friend that they should be looking for.
Absolutely. So again, May's Mental Health Awareness Month, such an important topic, and I think that giving this some credence and some time is such a valuable thing. As a mental health professional, one of the things that we're looking for, and we advise families and other family members or friends to look for, are sudden changes in behavior for folks. Sometimes it's a change in sleep, sleeping too much, sleeping not much at all. Sometimes it's a change in activity level. It could be a change in eating habits. So extreme changes are oftentimes a telltale sign in that moment that maybe something is going on that should be addressed with your family member, friend, loved one.
So what should we do? Let's say we notice some of these changes. What would be the first step? And how do we even begin a conversation if that might be what we feel like we need to do?
Absolutely. I think that so many of the traditional stigmas have changed and have evolved, and these conversations are more common nowadays than they used to be in years past, and that's a good thing. However, sometimes there's still some apprehension and some discomfort with bridging those conversations. What I always say is lead with compassion.
Okay.
There's an old saying that people don't care what you know till they know that you care. And so when you lead with compassion and you indicate to the person that you have their best interest at heart and that you just want to connect and learn about what's going on with them, being a source of encouragement, compassion is the key to these conversations.
And I can see that because I know when someone comes to you, you're not sure what they're coming to you with, and if you're hurting inside, that can actually just kind of calm someone. Chris, talk a little bit about how important community is, neighbors, churches, schools, even people you work with when it comes to this, and how that support.
Absolutely. I think that oftentimes people on an individual level struggle, with seeking out mental health care. Sometimes we're more prone to seek out more traditional, physical health, traditional medical health, but sometimes we're apprehensive about that. Having a loved one, a friend, a coworker, a person that they go to church with, reach out to them, make a connection, and encourage them to access mental health care. Sometimes that is the difference maker in getting that person to actually engage with mental health services. So oftentimes people come in and they say, I really thought about this for a long time. I've struggled with it. Someone encouraged me, a family member, somebody else that had been in counseling, and I'm so glad that I did. And I know that I'm going to get better. I know that there's good for me here. And it's that bridging that initial gap that is so critically important.
And I know sometimes just driving and going to an appointment to talk about your mental health can be a big obstacle, the transportation, but you all offer telehealth. Tell us about this.
We do. In our field, we were an early adopter with this many years back, but of course the COVID pandemic sort of fast forwarded that technology and mental health all across the world. And for us, it's been a game changer. We work in Central Appalachia, and we know the challenges with transportation, but it offers us a great deal of flexibility for people that traditionally couldn't access care coming into our offices because of transportation issues, lack of public transportation, and so forth. They can now access care in their home, and it's sort of on an equal playing field in terms of billing and insurance and all those things. So it's really been a game changer. Those folks that are isolated, perhaps depressed, now they have the ability to have a licensed mental health professional there in their home with them. It's been a game changer for our field.
Yeah, it sounds like it.
Now, with this month being Mental Health Awareness Month, Chris, is there a message you would like people to hear, maybe if they're struggling or really unsure of how to get help themselves?
Absolutely. I would say that, mental health it's a right. Mental health is health. It's no different than any medical need that someone would have. The mind and body are connected. And so if you stress the body, you also stress the mind. But if one's suffering from depression, anxiety, other mental health issues, that manifests in the body too. So you really can't separate those two things. So don't think of them separately, thinking of them as an interconnected feature. And, just, again, there are people that are out there that are well-trained, that are there there that are compassionate, who will afford you care. Reach out. You're worth it. You deserve it.
Yes.
And remind us, what is the best way to reach out, to get in touch with you all? We've got some numbers right there.
Our numbers are there. That's a toll-free number for the organization. We also have a website. We have an extension on the website for our counseling program that someone can digitally request an appointment with our counselors, and we'll respond and get them in as soon as possible.
And I think sometimes having a digital way to reach out might be something. People tend to really not even want to pick up the phone anymore, and especially if they're dealing with a mental health situation.
Yeah, we have on that website extension on our website at CAP, we have pictures of our staff. We have some of their expertise, the different credentialing that they have, insurance that we accept, all sorts of different things that sort of make them feel more comfortable and being able to choose us, and other folks have that as well. But that's with younger generations, that's just hugely important to access care.
Well, Chris, thank you and your whole crew for what you all do on a daily basis, not just in the month of May here, but and stopping by and sharing how people can get in touch with you.
Thank you for having me.
Yeah.
Thank you so much.